everyone, I'm back tonight, and today we're going to talk about prolapse after childbirth. So earlier I had a post on Facebook and I asked what topic you want me to talk about. So there were quite a lot of responses for this particular topic, and there seems to be many people who actually wants to know more about prolapse after childbirth. Okay, today good news, we have very few cases today, new cases today of COVID-19. So now during MCO, everybody's bored staying at home. I'm also bored staying at home. I used to fetch my children going here and there at night for tuition and classes, and now I have nothing else to do in the evening, so I'm here to do more and more live videos during this MCO. Okay, so MCO may be something that affect our life a lot, but one thing for sure, childbirth still goes on. Everybody is still giving birth, and we expect a lot more people getting pregnant during MCO, so there will be a lot more childbirth after this. And prolapse is something that many people worry about, because although all of us want natural birth, but one thing about prolapse is something that everybody still worry about, and there is actually a lot of traditional practices to prevent this prolapse. And sometimes when you think about what people are doing traditionally for this prolapse, it doesn't, some of the things you will know that it doesn't actually make sense. Okay, so one common practice for prolapse that many people do is they go for urut. They say they urut, they can pull up the uterus. Yes, but if you really understand why prolapse happen, you will know that urut doesn't solve your problem. Because urut, you pull up the uterus, but problem is what happens? There is something that the uterus is sitting on. The uterus is sitting on something. If this thing is no longer intact, your uterus is going to drops down. So if you pull up the uterus with urut, do you think the uterus will stay there forever? It won't, because whatever is down here is not intact, it will drop down again. So urut doesn't help for prolapse at all after childbirth. But it's good to urut, don't get me wrong. I think urut is a good thing, because women during the postnatal period need to have some form of relaxation, de-stress. You know, women get postnatal blues, postnatal depression, so we need time for them, a way for them to de-stress, to relax, you know, to get away from the baby for a while, to have somebody to chit-chat with that is not somebody that is from the family. At times it's good to have somebody to talk to you, have some urut. You feel relaxed, you know, relax all your muscles. And yes, a lot of mothers during confinement also get a lot of pains here and there on their body, and urut will definitely help them. So I think the traditional urut is good, but to believe that traditional urut is going to help your prolapse, it doesn't happen that way. Okay, so there's another myth, I will call it. There are people who believe that to prevent urut, you need to lie down on the bed every day during your confinement. Don't walk here, walk there. So pregnant women will ask, after giving birth, these mothers after giving birth, they were advised by the old people that they cannot move around, they have to lie down all the time, because if you move around then you will have prolapse. Again, it doesn't make sense, because it's most important is still the support that you have for the uterus. If the support that you have is no longer there, then even if you lie down every day also, the uterus will still prolapse. Okay, so yeah, in our country we have around 70 to 80% of women who give birth in Malaysia actually will have a natural birth or a vaginal birth. And of course, one of the complications or side effects of natural birth is prolapse. Now, first of all, you need to know everybody gives birth, right? You look at all the mothers who give birth, everybody gives birth, but not everybody get prolapse. Then why some people get prolapse, some people don't? So there are certain reasons to it. Okay, first we talk about risk factors. Risk factors is the elasticity of the tissue. You see, how much can we pull your skin and your muscle before it tears? The elasticity. So elasticity is something very individual, and we say that it's very, in a way, very much hereditary. So if you have if you come from a family with many prolapse, then you know you're at high risk of prolapse. So because I know some people whom they have a lot of prolapses in their family, and even though they have cesarean, they also got prolapse. Okay, Rukaya, up though Rahim asks whether is prolapse dangerous, no, it's never dangerous. It will never kill you. It doesn't cause you any problem. It causes you problem. It doesn't kill you, so there's no danger. But it causes you a lot of problem. It's more of a discomfort. Because why? Number one, look at what prolapse does. I'm going to show you a picture of uterus, okay? So, yeah, this is a picture of a uterus if you can see, alright? So, in most cases, we say that the uterus reaches here. This is the vagina. But in prolapse, this level of uterus will slowly go down with time. So, you slowly go down. So, let's see, yep. So, this uterus, the level of the uterus will go down with time. And in very bad prolapse, the entire uterus is outside. So you have your uterus outside, in between your thighs. So earlier there was one mother who asked me, how to know I got prolapse? Oh, you know, because it's outside. So when it is in the inside, it's still inside. Actually, I would say most women, when they give birth, this uterus will somehow still drop down, but not outside. So if you drop down a bit, you won't feel it. I need to do a special scan to see it. You can't feel it. You do not know that your uterus has dropped down. But if it's outside, you definitely know. So when the uterus is outside, it can be a problem because you have something outside to walk. It can be a problem. And uterus is meant to be an organ that's kept inside. Inside, it will be kept inside, warm and moist. When it comes out, it's dry and cold, and that is when it also causes a lot of problem. So, yeah, prolapse causes some problem. What are the problems that it can cause other than it being outside and dry? When it's dry, it will bleed, it will tear, it will bleed because it's not meant to be outside. So it will be very scaly, and the skin can actually crack and bleed and get infection, and not to mention it's outside. So can you imagine now you have something in between you? Okay, so if you have your uterus outside, then most of the time we know that it's going to be very difficult for you to walk around. So most people with the uterus outside, you see most of these older ladies usually, they don't go anywhere, you know. They don't go anywhere. Chi Ann asked whether it will affect fertility. It has never been a question, you know, about what do you call that, prolapse affecting fertility, because normally prolapse happens with people with multiple children, you know, so that has never been a question okay. So most of the people, if your uterus is totally outside, I'm quite sure you have tons of children at home already, so fertility is never an issue. No, it's not supposed to affect fertility either, okay, but it has never been an issue because it's usually among the older women and usually they have a lot of kids. Okay, Rokaya asked the second question, if there's a surgery to settle the problem. Yes, there's definitely surgery to settle the problem. I'll talk about treatment much later. So again, back to what are the risk factors. Risk factor number one is whether you are what do you call that, genetically prone to what do you call that, prolapse. Got to do with the elasticity of the tissues down there. So that's why even when we give birth, when we as obstetrician, when we attend a birth, there's some women when we put our fingers in and we pull, they just stretch, you know, they just stretch nicely. The whole perineum just stretch nicely. There are some women you cannot stretch their perineum. It's so hard. You stretch, they tear. You stretch, they tear. So what happens in prolapse actually is during childbirth, the muscle unable to stretch the inner muscle of the pelvis. So it's the inner muscle unable to stretch, and then it actually tear off. That is what happened. So if it tear off and it's inner muscle, so I don't know whether I can get a picture of this in Google. The inner muscle tear off, and as a result of that, because it's inside, you also cannot see. So because most of the time when we get I got a nice picture like this. This is something that can happen after childbirth. You see, one side of the muscle torn, the other side of the muscle intact, and we typically say that it's usually only on one side. Rarely mothers will tear both sides. So the inner of the muscle tear, and then because it's inside, it's not the outer muscle. So when we stitch we stitch everything outside that is seen by us or felt by doctors, but we don't actually see the muscle that tear inside. So that is why when it tears and it's inside and it doesn't recover, then it will cause prolapse, because now you have a gap. You have a gap. It's the hole I showed you just now. Now you have a gap, and this particular gap, see, I show you again, you have a gap. And this particular gap is a hole inside, and the uterus can come down. So that's why I say just now, will your what do you call that, urut help you? You pull out the uterus where the gap is still there. So does sleeping and lying down throughout the whole confinement help you? No use, because even if you sleep down, the gap is still there. So unless the gap heals, if not, there's no way you can prevent a prolapse in that case, if it has already torn. So the only thing we need to do, the only thing we can do is, can we prevent the tear? Yes. Okay, some women are already prone to tearing. So this is something you need to ask back in your home, your sister, your mother, your grandmother, anybody with prolapse. So first of all, we want to know whether you're prone to it. Number two, when you're pregnant, please do perineal massage. If you know there's such a thing called perineal massage before birth, where we put our fingers in and we massage. Basically, we are trying to stretch the opening. So if you stretch the opening, that is more elastic. It's more elastic. So it can open, stretch out. So it can open bigger. So when the baby come out, it doesn't tear so easily. Okay. Does episiotomy also cause prolapse? The episiotomy doesn't cause prolapse because the episiotomy cut the muscle outside. Actually, in true episiotomy, very little muscle is cut, but it's also cut outside. So cut outside, we can stitch back. We are not worried about the muscle that is tearing outside. This muscle that I show you in the picture just now is very deep inside. It's near the bone there. So that one, it's nothing to do with episiotomy. Episiotomy is outside. So one thing is that, but most importantly, is still the way you birth. Way you birth. Number one, how do you give birth? If you have an easy birth, go to hospital after a few hours, and then after that you push like 20 minutes and it's out, then less likely to tear so badly inside. Or you have a very difficult birth. You push for the whole hour, and then at the end still cannot come out. Then the doctor had to do vacuum forceps, then more likely you're going to have a bad tear. So that is the first thing. The other thing is the size of your baby. Don't give her 4 kilo. That's why for those mothers who follow me in my clinic, you see I take care of your weight. I take care of your baby's weight. Because if you have a big baby, then this is something that is at risk to happen. So we want easy birth, not traumatic birth. Traumatic, we are not talking about emotional trauma or what. We're talking really about physical trauma. We do not want births that traumatize the perineal muscles. So we want small baby, and we want easy birth, and yeah, that's the most important thing. And after that, of course, with the more births, it tends to have more prolapse. Why? Because first of all, if your muscle already torn, and we know one thing, every time you give the same force to the same area, that place will tear again. Okay, let's say my muscle tear in my first baby, but maybe I recovered, the wound actually recovered, but maybe not 100%, but 70-80%. So 70-80% recover, then it may not prolapse, but I give birth again, then I give birth again, and then every time you give birth, then it's just going to keep tearing up. So that is why you have more prolapse with women with more children. So in the past, actually it's quite common to have prolapse, and most of the people, they only know when they're older. Why? Because there's also one more thing. Even they have one muscle prolapse, the rest of the muscle around, if it's still strong, it can still maintain my uterus at a certain level. But when we grow older, our muscle will start to lax and become weaker. So the rest of the muscle, even though it's intact, but it become weaker. So then there's less and less support, so the uterus come out. Very, very rarely do we see prolapse in young women that are still, just after 1-2 babies born. God, but very, very rare. I think in my entire 20 years working, I can count with my fingers how many. It's so very rare. So most of the time, it happens only when they are in their 40s. 40s is when it starts to happen. You start to see this prolapse coming more and more obvious. So initially, I would say we see more and more people getting prolapse as they grow older. So first is in the 40s, many women will start to feel a bit. Then in their 50s, you see more women feeling it, and 60s more. And those who feel 40 in their 50s, you'll find it's more prolapse. 60s is more prolapse. What do you mean by more prolapse? Okay, more prolapse, most of the time you don't know one. I have to scan. We have such a thing called perineal scan. If you do a perineal ultrasound scan, you can measure the distance of your uterus to the outlet. Okay, so let's say that is one. You can measure. That is how you know. And number two, as you prolapse more and more, as it comes out, you will start to feel. The initial part is when you go toilet, you feel something come out. You can feel your uterus every time you squat or you go toilet. But when you get up, it goes back in. That will be the mild, the slightly more moderate type lah. And then as it gets worsened, then it comes out when you go to toilet. Then you have to quickly go lie down on the bed. And then after that, you wait for the uterus to go back up. Then you can come up and walk. And that is as it worsens. And then thirdly, as it worsens further, it will come out. It will not go in so easily anymore. You have to purposely push it back in. And the worst case scenario is when it comes out and there's no way you can get it in. That is the last. So we have 1st degree prolapse, 2nd degree prolapse, 3rd degree prolapse, 4th degree prolapse. So yes, somebody asked me about, Liana Amran asked me how to differentiate which pelvic organ are prolapse. Okay, you can never differentiate, we all can see. Because sometimes you see prolapse, but it may not just be uterus. It can be your bladder, it can be your bowel. So basically, there's a hole there. Anything from your tummy can come out. So does it help with Kegel exercise? Of course, it helps with Kegel exercise. That's why we're supposed to do Kegel exercise after childbirth. But there's a lot of problems with Kegel exercise because everybody see Kegel exercise from YouTube. They learn from books. They read up about Kegel exercise. But when you do it on your own, are you doing it properly? Are you getting professional help to make sure that you're doing properly? That's why for my mothers, I always get my physiotherapist to assess to make sure they're doing the Kegel properly. But Kegel is only something that you can do when you're young lah. So Kegel is a good thing to do. It will delay your prolapse, but I don't believe it will prevent your prolapse totally. So let's say if you do Kegel after childbirth and you continuously do Kegel for the rest of your life, maybe instead of getting your prolapse in your 50s, now you get in your 60s lah. Because somehow with age, your muscle will be weakened. When the hormones is gone, your muscle will be weakened. So it all depends only really it all depends on how bad your prolapse is. Not everybody will have the tear. It's only when those who have the tear will more likely have a prolapse. Okay, so that is how you will know it. And that is uterus prolapse. Of course, you can have bladder prolapse, bowel prolapse, and some people, because the uterus prolapse, then after that they cannot pass urine. Actually, your uterus prolapse can block the urine from coming out, so that can be a problem. But of course, associated with the prolapse, some people don't have prolapse, but they only have urine incontinence, fecal incontinence. All this, actually the cause is the same. It's due to the muscle tearing and causal weakness around the vagina, the uterus prolapse, weakness around the bladder outlet, then you have urine leaking, and weakness around the bowel area, the anus. Then you also can have difficulty in controlling, like some people, they have difficulty controlling their fart, their kentut. So that can also be totally due to the prolapse and the laxity and the muscle tear. Okay, Rukaya asked a question, is there an easiest way to overcome prolapse? My mom gave birth to 10 children. First of all, your mom 10 children, not even sure whether your mom will have prolapse, because we do not know whether the muscle tear. Not everybody who have prolapse is due to not everybody who give birth will definitely have prolapse, okay? Some people don't. Stephanie asks, what should we do? When should we do the checkup for this after birth? It's not a routine to do for most people, I would say. In my clinic, I do it is because I have a physiotherapist that can help me with this Kegel exercise. So in my clinic, after all the mother after childbirth, when they come for the postnatal clinic, I actually do a perineal scan. Perineal scan, we actually measure everything to see if there's any prolapse. But not just the uterus, also look at the bladder outlet, look at the urethra, which is the tube that the urine passes through before the urine comes out. So that area, whether there's any laxity and whether your bladder has dropped down, because I have quite a good physiotherapist in my clinic who will be able to assess after we scan. If I see any signs of prolapse or laxity of your urinary tract, I will send them to her, and I will send you to her, and she will teach you how to do proper Kegel. And in fact, it's very effective. I've seen many mothers, even urine leak. Urine leak is very effective because you know, you do and then you see no more urine leak. That's why you know you've done it properly. Okay, Wei Xuan asked, but as I say, this perineal ultrasound scan is not a routine. It's a routine in people who come to us when we say, hey, I got prolapse, doctor, or hey, doctor, my urine leak. There are a lot of doctors may do the perineal scan, but it's not something people do after childbirth lah. But I do lah, because I have a physiotherapist that is very good at all these Kegel exercises. Okay, when should we start doing perineal massage? We always say at 36 weeks. 36 weeks, okay? Okay, Wei Xuan. Yup. Can prolapse heal itself? Can. You can do Kegel. Kegel is actually a compensatory mechanism. If your muscle already tear, now we do Kegel to work on other muscle to hold your uterus. Whether that tear will heal is also very individual. Sometimes it will heal, sometimes it won't heal. We won't know, because it also depends on how bad the tear. Some people will heal, some people won't heal. We won't know. So it's those who don't heal. But even if heal, if you're going to have another childbirth, you're going to tear back, because once torn, it's always easy to tear again. So yup. When Stephanie asks, when should I do the scan, perineal scan? If you want to do, normally I do it after childbirth, usually about 2 months, 3 months. No harm. You can even do it later. If it's there, it's there. It's not there, it's not there. It's like if I see after childbirth, if it has, and I send you to physiotherapist, 1 year later you come back, you want to assess again, I'll just assess again. It can improve. It can improve with time, because everything can be measured, so we know whether you have improved or not. Yes, very good. Any more questions? Let me see before I talk about treatment. Okay, treatment other than Kegel. As I say, Kegel is something you can do when you're young. It's something that is more of temporary. It helps to delay the actual prolapse, but it cannot totally avoid, because once you're older, you may not be able to do your Kegel anymore, and your muscles may be weaker when you're older. So question is there anything I can do if, let's say, one day I really have this prolapse? Okay, so if you have the prolapse, there are many things we can do. If one day it's really happened, and usually it's the much older women, maybe 50s, 60s, if you really have the prolapse, what do? There are many things we can do with prolapse. Okay, yeah, Rukaya asked again about the physiotherapist. Yeah, normally we have to diagnose the prolapse, then we see the physiotherapist to do the thing. But physiotherapists, we try to look for physiotherapists that are specialized in women's health. That's why I have one in my center. Not many places have physio that specialize in women's health, but there are. Even government hospital there are. Okay, so yes, treatment, surgery and no surgery. No surgery, Kegel exercise is one. Okay. And second one is we call a pessary, where we wear something to push the uterus up. We wear something to push the uterus up. Of course, when you wear something to push the uterus up, then that's one way, but we also know that this is a temporary measure again. You have to wear that thing every day for the rest of your life. And some not so lucky women, after when they grow up to a certain age, they can't wear it anymore because they're so old and thin, and I would say their skin all thin out, and when we wear a pessary inside, it tends to cause a lot of bleeding, and then it may not be suitable anymore eventually. And this pessary is also a problem sometimes, especially because you need to change, you need to wash, you need to clean it, you know. So this pessary is not bengkong. Pessary we wear inside the vagina, we push something into the vagina. Okay, bengkong, I mean, it doesn't help prolapse at all. So you need to take it out of the vagina to wash it, to clean it, and push it back in regularly. And then can you imagine who's going to do it? When you're young, you can do it. When you're 80 or so, can you do it? Okay, if you want to go and see doctor to do it, when you are 60 years old, you can drive the car, go and see doctor, or your husband can drive the car, go and see doctor. When 80 years old, how? So that is why it can be a problem sometimes for pessary if you're talking about long term. Temporary is fine, it's nice, cheap and easy, but long term it can be a problem, and when it's a problem, you're very old already, then it becomes a bigger problem. Okay, then other than Kegel and pessary, then they are all surgeries. Surgery also got a lot of surgeries available. You have temporary surgeries that has a recurrence. Actually, if you look at the history of surgery for prolapse, it's gone through a long way because we couldn't find the perfect surgery, because a lot of surgeries that we do, there are problems. What recur? Because prolapse worsen with time. So I reduce your prolapse today, but you worsen with time, they come back. So there are a lot of surgeries that can be done, but they are temporary. So let's say the common things that are done, what they do, surgery to push everything up. Do surgery to push everything up, the most can tahan you 5 to 10 years only, because you're going to recur. Why? Because you are going to prolapse more and more with time. So I push up, then you come back down. And then there's another thing about removing uterus. Removing uterus also no point, because your uterus prolapse, I remove your uterus. Then the bladder come out next. Then the bowel come out next. You can anything can prolapse through that hole already, because there's a big hole there. So that's why people who remove uterus, or those days when we remove uterus, we used to combine with pelvic floor repair, where we actually push everything up. So even you remove uterus with pelvic floor repair, there's still 30% chance of recurrence. So recurrence is one problem. Second problem actually is the side effects of the surgery. Sometimes it can cause a bit of urinary problem after the surgery. So originally your urine is fine, and then after that you got urine leak. So this is one of the side effects of the surgery. So because of this imperfection of the surgery, that is why we have changed the surgery again and again and again, until now we already have a perfect surgery. Our perfect surgery is to do a sacrocolpopexy. Sacrocolpopexy means I'm not going to remove anything. I'm going to go into your tummy and tie something onto your uterus and pull the uterus up. Now I'm going to pull up and attach it to something inside your tummy, so it doesn't come down anymore. Because in the past, when we do a lot of pelvic floor surgery, pelvic floor repair, we actually do a lot of surgery from the vagina, and they get a lot of vagina tightening, and then after that some women cannot have sex, which is also another problem with the older type of surgery. So the perfect surgery now is to hold on to the uterus, pull it up, and attach it to somewhere inside your body, to one of the ligaments higher up that is not affected by childbirth, that is totally intact, and that is what we do, sacrocolpopexy. Okay, so that is the perfect surgery that have very minimal recurrence rate, very minimal problem to the urine, and no effect on the vagina at all, no tightening, nothing, because we just returning everything back to its original position. The whole surgery in sacrocolpopexy is not so simple. We also lift up the bladder, we lift up the bowel. Basically, we lift up everything up to its original position, which is the perfect surgery for prolapse. Okay, and it is permanent. Rukaya has a lot of questions. Thanks. Actually, I love questions, because when you have questions, then I can talk longer. Some people opt to have a Caesar because they're afraid of this prolapse issue. Is it true that you you not give birth vaginally, we can avoid prolapse problem completely? Okay, the answer is no. No, not completely. For certain people who are slightly more prone to it, like those who are a bit hereditary, you will realize some of you have the prolapse even during pregnancy. Some of you already have the urine incontinence during pregnancy. You don't even need to give birth. Okay, even the baby pressing on can cause a lot of muscle laxity. That also can happen. But of course, you won't get that big tear that I showed you just now. So even if you have prolapse, it will not be very bad. It will not be very bad. But it doesn't prevent all your urine incontinence problems. So even cesarean mothers can have incontinence. So yeah, in a way, yes, it does help. But doesn't mean that I will have to do cesarean because I want to have this done, because you think about it. Okay, you do cesarean for 1 child, 2 child, 3 child, then you have to do 3 operations. Okay, and these 3 operations are major operations. If I have all natural birth, 10 natural birth, and then my uterus prolapse, I do 1 surgery. I do sacral colpopexy, which can be done laparoscopically or robotic. Not a major surgery. Only 3 small holes on your tummy, settle a problem. No need to open up the tummy big. Do you know that mothers after Caesar next day cannot get down on the bed, get down like want to die, so pain. You look at the mothers who do sacral colpopexy to bring up the uterus. The next day they all say, "Doctor, I want to go home." All my sacral colpopexy patients the next morning when I see them, they all say they want to go home because they feel so well. There's no pain, there's no suffering, so it's not worth it. To do Caesar for prolapse is not worth it, okay? Not worth it, okay? How can we know whether we have inner tear? We can only tell with the ultrasound, okay? You need a perineal ultrasound. We call transperineal ultrasound to look at the pelvic floor. There is such an ultrasound, rarely done. Only people who do a lot of prolapse work will do it. So not all gynaes do it. First of all, all your postnatal checkup normally don't do it, because if you go to a clinic set up for a postnatal checkup, they don't even scan anything. So most of the time it's not done. But in my clinic, I do it because I have a women health physiotherapist who can do wonderful job for all my mothers. Number 2 is usually the only people who do it. Again, you don't do it in your normal routine medical checkup. You go and do pap smear, you go and scan your uterus. Everybody scan your uterus, nobody scan your pelvic floor. When people who want to do it usually are people who already go to the doctor with prolapse. Like if you come and see a gynae, you say you got prolapse, then gynae you do all. Okay, so that's when we usually do that scan. Okay, so okay, any more question? Rukaya is very interesting. Okay, she says it's very difficult to when someone close to you asks you why you give birth naturally, why not choose the easy way? I never believe that Caesar is easy. Okay, I had cesarean for myself. I never believe that Caesar is easy. I always envy people with natural birth, because people with natural birth, after natural birth, you see they're walking around, everything so well, so easy. They get out of the bed so easy. I never feel that cesarean is an easy option. Cesarean is not easy. Every time you Caesar, you go through a lot. Whereas natural birth, the more you have natural birth, the easier it's going to be, okay? Okay, can they still scan it after a few months from birth? You can scan it anytime. You can scan it anytime. Not just a few months from birth, Jay. You can scan it anytime. 1 year, 2 years, 3 years. Because if it's there, it's there. If it's not there, it's not there. So it doesn't really matter. Anytime you can scan. That's why people come and scan when only they got prolapse. You still can scan. It's still there. Okay, so if it's there, it's there. It's not there, it's there. You can scan it anytime. Okay, I guess any more questions? If not, let me think what I have just I've missed out something. I've spoken about the risk factors. So the key behind it is prevention. I believe in prevention more than anything else. Okay, prevention would be what do you call that? Prevention most importantly is do perineal massage. Don't want big baby, take care of your diet during pregnancy, get your baby small, and then take up childbirth classes so that you know how to give birth easily. Okay, we want easy birth. When you have easy birth, then your chances of prolapse will be less. Okay, that is prevention most importantly. Number 2, after childbirth, whether you get a scan or you don't get a scan, there's no harm doing a Kegel exercise. If you need to find somebody to make sure you're doing it properly, you just get some women health physiotherapists who can make sure that you're doing it properly. So that is the best thing you can do for now. So if you actually have the prolapse, then only we decide what to do with you. Whether you want to wear a pessary, whether you want to wear a, what do you call that, do a surgery. Of course, once again, sacrocolpopexy is the gold standard surgery for prolapse. Okay, miscarriage and prolapse got nothing to do. Miscarriage and prolapse have no connection at all. Okay, a lot of people choose Caesar because they can choose time. I think people choose Caesar to choose time. It's not nowadays. It's since the dawn of time. And if you listen to doctors who have worked for, I like to talk to doctors who are like, you know, in their 70s, 80s, in the past even more, because in the past they really believe that the timing of the birth determine the fate of the child. Nowadays, many of us are very open. We don't even believe in all these things anymore. Okay, Sarah asks, is there such a thing as painless birth? Of course there's such a thing as painless birth. There's so many painless birth, but we want to talk about painless birth, it's a big topic altogether. So if you still have any question, put it up on my post, because I have this post a couple of days back. If you anything you want me to talk about during this MCO, any more live videos you want me to do, any topic, I'm open to all of you. Put your topics up, and if you find somebody else having the topic who have post up a topic and you think that is something you want, you just need to like. The more likes I get, the more likely I'm going to talk about it. So you go back to my post a couple of days back, in the comment, write the topic you want, and browse through the rest of the comments. If you see some nice topic, please like it, and then I will talk about it. Okay, I think, yep, any more. Okay, I think that's all for now. Okay, good night. Thank you for watching, and see you again in 2 days time, Sunday, same time, 9 p.m. 9 p.m. is my live video time, and this time I'm going to talk about endometriosis and how to cope with the period pain that they have. Okay, very interesting topic. I'll be talking about certain things that you will not be seeing in any books or any website. Very interesting things that I can share with you all this Sunday. Okay, thank you. Bye bye.